the toxicity of the drug supply has changed tremendously due to border closures.
And the bottom line is, it's gotten more lethal. According to Addictions and Mental Health Ontario, illicit drug manufacturers can no longer access the substances smuggled in before the pandemic, so now they're mixing their supply with what they have on hand. Substances far deadlier, and the result is devastating the province.
We have seen that deaths due to overdose have increased by between 35 and 40% on a weekly basis. And in those cases, 3/4 of people were alone when they used.
More potent drugs require more naloxone. In the past few years, first responders have had to adapt.
We only used to carry a total of 4 milligrams in every ambulance. Are now carrying, the average across Ontario is 12 milligrams of naloxone available at all times in every ambulance, specifically because things like purple heroin are so much more powerful.
A standard dose of naloxone through the veins, Wilton says, is 0.4 milligrams. But some of those ODing on poison drugs may require up to 20 milligrams of naloxone, 50 times the regular amount.
Yes, of course, when you have an unregulated product, there's always a possibility of it being adulterated or contaminated.
But what if the product was regulated? That means the government would have control on the price, potency, and packaging of these substances, and the consumer would know exactly what they're getting.
Under legalization, there is increasing scope, at least, to understand the motivation of the user and why they might be using.
Hathaway and Spafford say this encourages others to think of the issue as a health crisis, not a criminal one, meaning the government could focus its resources tending to users' mental health and socioeconomic needs. Advocates say regulation also harbors more honest conversations where awareness on adverse effects increases. Canadian consumers have seen this firsthand with another substance, cannabis.
And what we see is that Canadians right before and right after legalization were reporting greater information and health knowledge. And you know what? When we talk to consumers of different substances, that is exactly what they want. Most of them want more information, are curious about what they're taking and what the effects might be.
Hathaway and Spafford say legalization is a major step in saving lives. But until more money is invested in mental health, treatment, and harm reduction avenues, the drug epidemic will continue to kill. Noor Ibrahim, Global News.